Dear viewers, this video is part 2 in the three-part series on cancer prevention in the Medicine for Anyone YouTube channel. Cancer prevention, the ultimate goal. Any type of cancer that is common in one population is rare in some other, and that the differences between populations are mostly not genetic. Many cancers occur in large part as a result of the way people behave and the circumstances in which they live, and they are therefore, at least in principle, preventable. This does not mean that we can at present envisage a society in which any of the common cancers are completely eliminated, although this may prove to be possible when we understand more clearly the mechanisms by which they are produced. What it does mean is that we can envisage a society in which the age-specific risk of developing any type of cancer is low. Burkitt's lymphoma is at least 100 times as common among children in parts of Uganda as it is in Europe and North America. Kaposi sarcoma was extremely rare in most of the world until the advent of AIDS. It became so common in children and young adults in parts of Central Africa even before 1970 that it accounted for 10% of all tumors seen in one of the African hospitals surveyed by Cook and Burkitt. Some few cancers occur with approximately the same frequency in all communities, but all are relatively uncommon. Acute myeloid leukemia at 15 to 25 years of age is an example. Nephroblastoma is another, except that it appears to be only half as common in Japan as elsewhere. Dear viewers, by the way, this educational video is made possible by Prescribon, the makers of e-prescription software for digital prescriptions available freely for doctors on the website www.prescribon.com. Doctors who are interested in this e-prescription can freely avail of its vast collection of more than 100,000 e-prescriptions. Avoidable risk factors. Smoking cessation. See also tobacco and tobacco-related diseases in Medicine for Anyone YouTube channel. Tobacco smoking is a strong modifiable risk factor for cardiovascular diseases, pulmonary disease, and cancer. Smokers have about 1 in 3 lifetime risk of dying prematurely from a tobacco-related cancer, cardiovascular, or pulmonary disease. Tobacco is by far the most important single cause of cancer in developed countries. Chewed, it can cause cancers of the mouth and esophagus. Smoked, it's a major cause of cancers of the mouth, pharynx, other than nasopharynx, esophagus, larynx, lung, pancreas, renal pelvis, and bladder. For these 8 cancers, epidemiological evidence indicates that prolonged smoking of average numbers of cigarettes per day increases the risk 3 to 20 times. Tobacco use causes more deaths from cardiovascular disease than from cancer. It is, however, now clear that cigarette smoking also causes a proportion of several other types of cancer, increasing the incidence up to thrice that in non-smokers, namely cancers of the lip, nose, nasopharynx, cancers of the larynx, oropharynx, stomach, colorectum, cervix, liver and lung cancer, and esophagus, pancreas, kidney, bladder, mucinous ovarian tumors, and also myeloid leukemia. In general, women in developing countries do not smoke, although there are particular regions in China and India where they do so. In men, however, there has been a very large increase in worldwide cigarette consumption over the past few decades, the full effects of which have yet to materialize. China, with 19% of the world's population, smokes 37% of the world's cigarettes. Smoking now accounts for 25% of cancer deaths. In India, smoking caused 32% of all cancer deaths in men and 5% in women in the early 2000s, and 20% of all male deaths in India at ages 35 to 69 in 2010, partly because smoking can act as a cofactor for the production of cancers of the mouth, esophagus, or stomach in those who habitually chew quids containing betel and tobacco. Overall, tobacco smoking may be causing as many cancer deaths in developing as in developed countries, in which case it would be responsible for about 20% of cancer deaths throughout the world. Chewing tobacco is a carcinogen linked to dental caries, gingivitis, oral leukoplakia, and oral cancer. The systemic effects of smokeless tobacco, including snuff, may increase risks for other cancers. Esophageal cancer is linked to carcinogens in tobacco dissolved in saliva and swallowed. The number of cigarettes smoked per day and the level of inhalation of cigarette smoke are correlated with risk of lung cancer mortality. Light and low tar cigarettes are not safer because smokers tend to inhale them more frequently and deeply. Those who stop smoking have a 30 to 50% lower 10-year lung cancer mortality rate compared to those who continue smoking despite the fact that some carcinogen induced gene mutations persist for years after smoking cessation. Smoking cessation and avoidance would save more lives than any other public health activity. The risk of tobacco smoke is not limited to the smoker. Environmental tobacco smoke, known as second-hand or passive smoke, causes lung cancer and other cardiopulmonary diseases in non-smokers. Tobacco use prevention is a pediatric issue. More than 80% of adult American smokers began smoking before the age of 18 years. Approximately 13% of Americans in grades 9 through 12 reported using two or more tobacco products. Electronic cigarettes have been advanced as a tool to achieve smoking cessation in adult smokers, but there is concern that they serve as a gateway to cigarette uptake in adolescents and are increasing in use. Counseling of adolescents and young adults is critical to prevent smoking. Smokers who quit completely are more likely to be successful than those who gradually reduce the number of cigarettes smoked or change to lower tar or lower nicotine cigarettes. More than 90% of Americans who have successfully quit smoking did so on their own. The health risks of cigars are similar to those of cigarettes. Smoking one or two cigars daily doubles the risk for oral and esophageal cancers. Smoking 3 or 4 cigars daily increases the risk of oral cancers more than 8-fold and esophageal cancer 4-fold. Smokeless tobacco also represents a substantial health risk. Alcohol. At least 6 types of cancer are caused in part by the consumption of alcohol. 1. Liver cancer is produced mainly by the production of liver cirrhosis and is consequently caused mainly by heavy and prolonged consumption. 4 are causally related to smoking as well as to alcohol, namely cancers of the mouth, pharynx other than nasopharynx, esophagus and larynx. The two agents act synergistically, increasing each other's effect so that the risk from alcohol in non-smokers or long-term ex-smokers is very small, while that in heavy smokers is disproportionately large. The remaining type, cancer of the breast, has been shown to be related to alcohol more recently. The risk increases progressively with the amount drunk, at least up to moderately high levels. Laboratory studies show that alcohol increases the level of estrogen in the blood. Ultraviolet radiation. Photon energies in the ultraviolet range are sufficient to damage DNA and hence to cause cancer mutations. UV does not penetrate much below the skin, so that it is chiefly within the skin that it is directly carcinogenic. Within the skin, however, it is the principal cause of all types of cancer other than Kaposi sarcoma. The main source of human exposure to UV radiation is sunshine. Infection. Infection, principally viral, but also in some cases bacterial and parasitic, is a major cause of avoidable cancer, especially in developing countries. In sub-Saharan Africa, about 40% of cancers in women and 30% in men, compared with about 10% in developed countries, are attributable to infections. Sun avoidance. Non-melanoma skin cancers, basal cell and squamous cell carcinomas are induced by cumulative exposure to ultraviolet radiation. Intermittent acute sun exposure and sun damage have been linked to melanoma, but the evidence is inconsistent. Sunburns, especially in childhood and adolescence, may be associated with an increased risk of melanoma in adulthood. Reduction of sun exposure through use of protective clothing and changing patterns of outdoor activities can reduce skin cancer risk. Sunscreens decrease the risk of actinic keratosis, a precursor to squamous cell skin cancer, but melanoma risk may not be reduced. Sunscreens prevent burning, but they may encourage more prolonged exposure to the sun and may not filter out wavelengths of energy that cause melanoma. Viral infection. Below is a list of viruses known to cause human cancers or suspected of doing so, along with the types of cancer with which they are associated. Not all infected people develop the disease. In some cases, the proportion of causing cancer is quite small unless other factors are also present. Such cofactors include endemic malaria for Burkitt's lymphoma, the consumption of a type of salted fish for nasopharyngeal cancer, and the consumption of aflatoxin, a metabolic product of fungal infection, with Aspergillus flavus for liver cancer. What the cofactors are for the cancers produced by the human papillomavirus is not known. Viruses that are known to cause human cancers or suspected of doing so are listed: hepatitis B, cancer of liver; hepatitis C, cancer of liver, non-Hodgkin's lymphoma; HPV types 16, 18 and others; cancers of the cervix, vulva, vagina, penis, anus, oral cavity, oropharynx, tonsil, some skin cancers; HHV types, EBV, type 4, Burkitt's lymphoma, post-transplant lymphoproliferative disease, nasal T-cell lymphoma, other non-Hodgkin's lymphoma, Hodgkin's disease, nasopharyngeal cancer; HHV type 8, Kaposi-associated herpes virus, Kaposi sarcoma, primary effusion lymphoma, human T-cell leukemia type 1, adult T-cell leukemia lymphoma, HIV, that is Kaposi sarcoma, non-Hodgkin's lymphoma, Hodgkin's disease, conjunctival carcinoma, cancers of the cervix and anus. Not all infected people develop disease. Quantitatively, chronic infection with hepatitis B virus is one of the most important causes of cancer in many parts of the world. In China, for example, liver cancer accounts for about 15% of all cancer deaths. the large majority of which are due to chronic lifelong infection with the virus. Infant vaccination against the virus is now being introduced and will protect those born in the present century, but will not provide retrospective protection for those born in the 20th century. Bacterial infection. Only one specific bacterial infection has been closely linked with the development of cancer: Helicobacter pylori. Persistent Helicobacter pylori infection acquired early in life leads to chronic gastritis in the antrum of the stomach and increases the risk of gastric cancer 2 to 3-fold. Non-specific chronic infection in the bladder may increase the risk of bladder cancer. So, dear viewers, this video is the end of part 2 in the 3-part series on cancer prevention in the Medicine for Anyone YouTube channel. Thank you for watching the video.